A pharmacist's knowledge of antimicrobials is helpful because sometimes physicians are not particularly confident in their utilization of them in various settings, where sometimes people are taught things like use this drug for this infection or for this indication that doesn't work very well in a changing environment where resistance patterns change not only hospital to hospital but patient to patient. But I think one of the single biggest areas for a pharmacist to educate others is by limiting the overall use of antimicrobials. The broad spectrum drugs that are originally given, sometimes out of fear, sometimes justified, when the patient first comes in, are often not justified several days later when culture results return. And while it's one of those things that is taught over and over, and certainly people are aware that we need to de-escalate our antimicrobials, when the patient's doing well, it's often not the first thing that jumps to people's mind. If it's working, just run with it. But we know better, or we should know better. And I think pharmacists often need to be the ones to kind of nudge them along and be like, hey, it's day 3, things are going well. Why are we still on, for example, vancomycin and Zosyn, plus metronidazole and so forth? You know what I mean? These regimens that may or may not have made sense empirically, but as time goes on aren't nearly as justified. Not all hospitals have infectious disease physicians, and pharmacists sometimes are going to need to step up to be the ones to nudge these treatment decisions along.